Hi, I'm Jarvis Odgers, physical therapist and clinic director here at Rebound Physical Therapy. Rebound is an outpatient, family-owned physical therapy clinic that has been serving Topeka and the surrounding communities since 1994. Today, I would like to talk to you about PT, or physical therapy, to help relieve hip pain. So first, I want to kind of address a misnomer. A lot of people, when they think about hip pain, they think about the older adult. And while it's true that we certainly see a lot of people that are in their 60s, 70s, 80s, and beyond that are dealing with hip pain, over the course of my career, the amount of the individuals that are either adolescent or young adults that are dealing with hip pain, sometimes some serious pathologies or even reconstructive surgeries, has grown exponentially. So it's really one of those that affects people of all ages and walks of life. So let's talk about a couple of causes of hip pain. So one is bursitis. So what is bursitis? Well, bursas are little fluid-filled sacs that cover where a tendon and a joint meet. And it kind of keeps that tendon from rubbing across that rough bone there, which is a good thing. But sometimes that bursa can become inflamed or irritated and become swollen and painful. Another common cause is tendinitis. So tendons are what link or tie our muscles to bone. If that tendon becomes overloaded, it can become inflamed and irritated, and that is what tendinitis is. Another common thing we see in the hip is labral tears. So the hip joint, it's a ball and socket joint, just like our shoulder, and the labrum is fibrocartilage, and it kind of makes that ball a little bit bigger, and it also kind of gives us some shock absorption and some padding in that joint. But sometimes that labrum can become frayed or torn away from the joint. And another common cause is arthritis or degeneration in that actual joint surface. So what do we do for treatment? Okay, as physical therapists, we are specialists in musculoskeletal orthopedic issues. The first thing is having a good, comprehensive physical therapy evaluation, where we get a look at how you move, what your joint feels like, how muscles are, and really get down to what I call the cause of the cause, kind of the root issue that is causing your symptoms. Once we've determined that, there's a whole host of practices that we use to treat that. One of them is hands-on manual therapy techniques. A lot of times that's soft tissue mobilization, getting a muscle moving and feeling better, also increasing some blood flow to the area to help that area heal. Another common thing we do is called joint mobilizations, joint mobs for short, which is basically stretching for the actual joint. So I think most of the time we think about stretching a stiff muscle. Joint mobs help to address the actual joint mobility and some of the non-contractile tissues around it. And then we develop a personalized plan of care for exercise and mobility. So it's not cookie cutter, it's addressing the individual's needs. Make sure that you're familiar with those in clinic, but then also give you those as tools for your toolbox so that you can work on at home, get yourself out of a bad situation, keep yourself out of a bad situation. So if you're out there and if you're dealing with hip pain, don't sit back, give us a call, let our team of experts help get you back in action.